So things about breast cancer endocrinology. Remember that estrogens and progesterone are the two hormones that are driving the development of breasts. This is why hormones are very important for breast cancer. So estrogen receptor alpha is one of the common genes found in breast cancer tumor cells. And it's also the thing is that if there's a lot of estrogen receptor alpha in breast cancer tends to promote the growth and proliferation and make it more aggressive. There's also progesterone receptor. So the thing about, even though if you do have these receptors in a breast tumor, it sounds very scary, and actually untreated, they are more aggressive, but there are drugs that block the effects of estrogen and progesterone. So if you block these receptors with drugs, you're actually able to these are more targeted. These are rather than just giving general chemotherapy that kills any dividing cells. So this is why often in breast cancer treatments, if a woman's breast tumors has these receptors, they will give drugs that affect these receptors. There's also human epidermal growth factor receptor 2, also known as HER2. And this is another receptor, and it does involve, it's a little more complicated, but there are, in terms of like signaling, but there are drugs that do target HER2 as well. Something called Herceptin, that is a drug that affects this receptor. So the good thing about knowing all these receptors is like if you know a breast tissue or a breast tumor has these receptors, you can give drugs that block or attack these receptors, and this helps the woman battle against breast cancer. So it's very important for treatment. Untreated, if you have these receptors, they're very aggressive, but we've developed drugs that help to combat these receptors in breast cancer. And then there's triple negative breast cancer. And what happens in that is that you have breast cancer that has a lack of all three of these aforementioned receptors. So the bad thing about this is that if you have the hormone blockers or this anti-HER2 treatments, none of them will work if there's no receptor to bind to. So triple negative breast cancer, often the treatment for that is that you give general chemotherapy. Again, that's like, the bad thing about that is that general chemotherapy, it affects all the cells that divide in your body. So this is why skin quality gets affected. The nails start to get brittle and chapped because again, your nails are always growing. This is why breast cancer patients or cancer patients that have general chemotherapy, that's why their hair falls off. That's why they have GI troubles. Your GI is gastrointestinal epithelia is always regenerating itself. So again, that's the treatment for triple negative breast cancer. But why do we have to do that? Because there's no targeting you can do if you don't have the receptor. Now, what are the risk factors of breast cancer? So age, that tends to affect more mature women. So most are diagnosed after menopause, so around at the age of 50 or more. So genetics also plays a factor as well. So family history, again, this is why my mom did a lot of, or does regular breast exams, because she has a family history. And actually, it's very interesting. So, compared, Asian Americans actually have a lower rate than the average population. But when you break it down by country, women of Filipino descent have an increased risk of breast cancer compared to women of other Asian descents and Japanese and Chinese descent. So my mom actually falls under this category. Like, okay, if you have a relative that has breast cancer, you're actually more at risk. The chance of you getting breast cancer is more than the average person. So if I had a daughter in the future, then I would probably tell her, like, yes, you should start doing these exams earlier than you would usually do. And there's also genes. Now, these aren't just linked to racial backgrounds. Like actually, BRCA1 and BRCA2 is associated with the Ashkenazi Jewish, but actually they're not just limited to the Ashkenazi Jews. Actually, it's like there are these little slight variants of BRCA1 and BRCA2 that make women more prone to breast cancer, and sometimes even like other reproductive cancers like ovarian or uterine cancer as well. So again, just like racial background and genetics, and age and menarche. So the thing is that the menarche, when you start your first period, the earlier you start it, the more risk you are at breast cancer later on in life. Or having a late or no pregnancy. The interesting pregnancy has a protective effect against breast cancer. They're still studying this, but it's like, how is this really? But they see statistically this is associated with lower risk. Age of menopause as well. Again, this is when it tends to be diagnosed. and still the most common cancer in women. So this is why breast cancer, we have Susan G. Komen, we have all these fundraisers, why we have a whole month dedicated to breast cancer awareness. So still the most common cancer in women, and it's very like when a woman experiences breast cancer, this is why they have support networks. It's emotionally devastating, especially if she has to go undergo a mastectomy to remove a breast. So the thing is that it does affect a lot of women. I get the last statistics is around 1 in 6 women in the US who has a lifetime risk. But the good thing is that we are winning the war on breast cancer. The good thing is that we are winning slowly the war on breast cancer. So it's now the second deadliest. So it used to be the deadliest, but thanks to all the fundraising, research, and awareness, now it's the second most deadly cancer in women. Now lung cancer, in terms of all the cancers, is the number one killer of women. But yes, so it's not down to zero. And actually, if you are very interested, I wish I was teaching that class, but there's a class, I love the textbook, it's called The Biology of Cancer. And I remember one quote from it is like, cancer is one disease, at the same time, it's also thousands. So the thing is that cancer arises from our own cells. So again, like where the thing is that they're often trying to do preventative studies. So this is why as long as we have breast tissue and mammary glands, and there is a potential for developing cancer. So why can't we just make it zero? Well, prevention is really hard to design and evaluate statistics over time. It takes time to do prevention versus, oh, someone has breast cancer, let's throw all these treatments on it. So it's really hard to prevent it. But again, all that research is not for naught. Breast cancer is no longer as deadly as it is, but it still kills women. And the thing is that it does have psychological effects. Like my mom was really depressed when she did get that. She was really anxious when she thought she had that breast tumor, but thankfully it was, again, just a fibroadenoma.